Thank you all. Please be seated.
Ladies and gentlemen, my name is Mike Levitt, and for the last 15 hours, I have been the Secretary of Health and Human Services, and I'm delighted to be with you today. It's fitting that my first opportunity as Secretary is to be with you on an event to celebrate and to focus on information technology and its value in developing high-quality health care. The goal is very simple: improved health care, which leads to happier lives, prosperity, and productivity. There's a very simple and direct formula that will be spoken about today. It is when people own their own health records, when they own their own health savings, their own health insurance, it produces better care, lower costs, and fewer mistakes. It provides freedom. Freedom if a person needs to change their doctor, or to change their location, or to change their job. So it's my pleasure today to introduce a man whose leadership has led to improved quality health care for millions, whose compassion has allowed for millions of senior citizens to have affordable prescription drugs, for more children to have health care and fewer of them to be on drugs. Ladies and gentlemen, welcome President Bush.
Thank you, Levitt. Thank you, Mike. No, thank you all. Thanks for coming. No, please be seated. Thank you. Thanks for the warm reception. It's great to be here at one of the nation's finest medical complexes. I want to thank you for giving us a chance to come by and talk about how to make sure health care is available and affordable for our fellow citizens. I am honored Mike Levitt has agreed to serve our country. He's been in the job 15 hours and he hadn't made any mistakes yet. But he is going to do a great job. He was a former governor from the great state of Utah. He understands the need for the federal government to relate effectively with state governments. The HHS is a complex organization with a lot of tasks. It requires good management skill in order to be an effective secretary. I am confident that Mike has got the skill set and the vision necessary to do the job. And so, Mr. Secretary, welcome to the job. I'm looking forward to working with you. I know a lot of docs are too, and you do fine. 15 hours and no errors is a good start. I want to thank Toby Cosgrove, the doc, the CEO and chairman of this fantastic facility, for welcoming us here. I'm honored, Doc, that you put up with the entourage and let us come and visit with the good folks here in the Cleveland area. I appreciate the docs who showed me the fantastic technologies that are now in place in this hospital. That's part of what we're going to discuss today. As you can see, I've asked some people who know what they're talking about to come and share the great excitement of information technology and how it can help change medicine and save money and save lives, and most importantly, make our fellow citizens make available to our fellow citizens a healthcare system that is responsive to their needs. And so thank you all for coming. I think you're going to find this pretty interesting. I know I'm going to. I want to thank the governor, great state of Ohio, for joining us. The last time I saw Taft, he was dancing on the stage at an inaugural ceremony. He's about as lousy a dancer as I am. I want to thank two members of the Congress who've traveled with me today on Air Force One, Ralph Regula, who is a fine member of the House of Representatives, as well as, thank you for coming, Ralph. As well as Congressman Steve LaTourette. We appreciate you coming, Steve. Is he over there? Yeah, he's still there? Good. I was going to say, if he skipped the deal, he wasn't going to get a ride back. I want to thank all the docs who are here. I want to thank all the people, nurses who are here, and the staff members who are here. I want to thank you for your compassion. And I want to thank you for lending your enormous skills and talents to saving lives. We got the greatest medical system in the world. And the role of the federal government is to do what is necessary to keep it that way. And I believe the reason why we're so good is not only because we're great at research, but our people are so compassionate and decent and care about their patients. I want to talk, by the way, I met a guy named T.J. Powell. Where are you, T.J.? There you go. T.J. was at Air Force One. The reason I like to mention somebody like T.J. is because he volunteers 1,000 hours per year in helping people as a member of the Ohio Medical Reserve Corps. In other words, he lends his talent and time to help people have a better life. My State of the Union, I'm going to talk about the strengths of our country, the economy, and our military. We intend to keep it strong, to keep the peace. But the true strength is the fact that we've got citizens from all walks of life who are willing to volunteer 1,000 hours a year to make somebody's life better. I thank you for the example you've set, TJ. I appreciate you coming. So the fundamental question facing the country is, can we have a health care system that is available and affordable without the federal government running it? I mean, it really is a philosophical challenge. There's some good, well-meaning folks who believe that the best health care system is run where Washington, D.C. makes the decisions. I happen to believe the best health care system is one where the consumers, the patients, make the decisions. And so here are some practical ways for us to deal with the rising costs in health care. One is to make sure that people who can't afford health care have got health care available to them in a common sense way. And that's why I'm such a big backer of expanding community health centers to every poor county in America. We really want people who cannot afford health care, the poor and the indigent, to be able to get good primary care at one of these community health centers and not in the emergency rooms of the hospitals across the United States of America. The best way for a compassionate society to help make sure there is a health care safety net is to expand these community centers, which are working. I mean, this is something we say. Are you going to fund programs that get results? And the answer is you bet, and these community health centers get great results. And so I'm looking forward to calling upon Congress to expand them to every poor county in the country. Secondly, we have made it clear our commitment to our nation's seniors, that we'll have a Medicare system that is modern. I can remember traveling the country explaining to people that Medicare would pay for thousands of dollars for a heart surgery, $100,000 for a heart surgery, say, but not one dime for the prescription drugs that would prevent the heart surgery from being needed in the first place. It didn't seem a very effective use of taxpayers' money to me, and it certainly said that the Medicare system wasn't modern. So I called upon Congress, and Congress acted, and I signed a bill that makes the Medicare system more modern to meet the needs of our seniors. Inherent in the reforms in that bill is giving seniors more options and more choices to choose from, which is a philosophy that I think you'll hear as we discuss what is available to help control costs. In other words, the more choices people have in health care, the more likely it is that costs will be under control. Let me give you an interesting idea that I think small business owners need to look at, and those are called health savings accounts. Or individuals need to look at it. Families need to look at health savings accounts. A health savings account is basically a plan that says you buy a high-deductible, catastrophic plan. In other words, you cover your first $2,000 of medical expenses, and then the insurance kicks in after that. And that to cover the routine medical expenses up to $2,000, your business contributes tax-free into the plan. And if you don't spend the $2,000, those if you make right choices about how you live and what you put in your body, in other words, if you prevent disease by exercising on a daily basis, and there's money not spent in the account, you can roll it over from one year to the next tax-free. And as you withdraw the money, you can do so tax-free. Now, the cost of the insurance for the high-deductible catastrophic plan is incredibly less expensive than the normal third-party payer system. And the savings on premiums from that plan more than covers the incidental costs necessary until you get up to the deductible. That's a complicated way of saying this works. And I ask small business owners to take a look at health savings accounts. most of the working uninsured work for small business owners who are getting squeezed by the high cost of medicine. This is a way to be able to afford health care for your employees and at the same time put your employees in charge of the decision making when it comes to health care. One of the issues in terms of the cost of health care is the fact that many people have their health care decisions made by third-party payers. So they're not really involved with the expenses and the expenditure of money. You know, you show up and the insurance company covers your costs, but you don't know what the costs are. And you're not involved in the decision-making. Health savings accounts, which will make life more affordable for employer and employee, really put somebody in charge of the decision-making. And that in itself is part of how you control costs. If you're out there shopping for a better deal, it helps bring cost efficiencies into a system that needs cost efficiencies. Another way to help people afford health care, particularly small businesses, is to allow small businesses to pool risk. Right now, if you're a restaurant in Ohio and a restaurant in Texas, you have to buy your insurance only within Ohio or only within Texas. I believe restaurants ought to be able to pool across jurisdictional boundaries so they can buy insurance at the same discount that big companies get to do. In other words, the more people you have in your pool of people to insure, the less expensive insurance becomes. It makes sense, doesn't it? But the law prevents people from doing that now. So here are some practical ways to help with the cost of medicine. Another practical way, and I want to thank the FDA for having responded to our call, is to get generic drugs to the market faster. Brand name drugs are protected by patent for a period of time to allow pharmaceutical companies to recoup their research and development. That makes sense. But what doesn't make sense is the company's ability to delay the arrival of generic drugs. They do the exact same thing brand name drugs do, but they're far less expensive. And so by speeding generic drugs to the market, we'll make pharmaceuticals more affordable to our seniors and take the pressure off our state budgets, which we're now in the process of doing. But we're here to talk about another way to save costs in health care, and that's information technology. Now look, most industries in America have used information technology to make their businesses more cost effective, more efficient, and more productive. And the truth of the matter is healthcare hadn't. I mean, healthcare has been fantastic in terms of technological change. I mean, you see these machines in these hospitals compared to what life was like 10 years ago. Things have changed dramatically. And healthcare has got, we got fantastic new pharmaceuticals that help save lives, but we got docs still writing records by hand. And most docs can't write very well anyway, so can you? Yeah. And so the fundamental question is, how do we encourage information technology in a field like healthcare that will save lives, make patients more involved in decision making, and save money for American people? That's what we're here to talk about. And I've asked Dr. David Brailer to join us. When we started the process of encouraging information technology to spread throughout healthcare and setting the goal that there ought to be every patient, every American ought to have a electronic medical record within, I think, 7 years. 7 years, 10 years? 10 years, yes, 10. I asked David, or I didn't ask David, Secretary Tommy Thompson asked David, and told me he asked David, to be in charge of the federal effort to do what is necessary to reduce the obstacles and roadblocks to get electronic medical records in the hands of every citizen. So I've asked David to join us to kind of help explain what I'm desperately trying to explain to you in English, and so that people understand why information technology can advantage our society. Why don't you start, David?
Okay, thank you, Mr. President. For 30 years, there's been discussion about physicians using computers to prescribe medications and to order tests. And this changed dramatically a year ago this month, when in your State of the Union address you called for electronic health records used in hospitals and doctors' offices within 10 years. Over the past year, we've seen a significant dialogue in the industry about how to make this happen. in July of 2004, we released a strategic plan that said how we're going to accomplish that goal, what Washington can do to clear the way to let the private sector, doctors and hospitals, accomplish this. And we've had enormous support from consumers groups who see how electronic health records can protect their privacy, from physicians who see how electronic health records can improve their practices, and from hospitals who see the same thing. And we've laid out really 4 areas that we're going to see pushed forward. Number one is that every physician is able to use an electronic health record, that when they see a patient, they have their notes available on the computer. They can order tests on the computer. They can get knowledge and information that's needed to pick the right medication or the right test and to communicate with other doctors. And we want to see this happen, and not just in big centers like Cleveland Clinic, but in small practices all around the United States, and not just in hospitals, but in ambulatory settings. And this is one of our major goals, and we have work to do to clear out some old regulations that get in the way of that, and other barriers that we think are able to be addressed, and that's our number one goal. But secondly, we don't want to see those all out there unless they're connected together. We call that interoperability, which is a way of saying that if a patient wants his or her information to go between doctors, to have their information when they show up in an emergency room, that their information's there, that has to be developed. We have to develop a medical internet, if you would, that securely transmits that information. That requires a lot of work, and we actually just asked the industry to tell us how this could work, and we've had over 500 different groups of companies come forward with plans about how that could work and how we build it and how we finance it and what the privacy protections are. And so connecting these together and getting the right standards in place is one of our major goals.
If you're in Florida, living in Ohio, you happen to go down to Florida. My brother's the governor, so I'm putting a plug there. But you go to Florida, you get in an automobile accident. An electronic medical record means your data to the doc in the emergency room is transmitted just like that, as opposed to calling somebody, getting them out of bed. Could you please go find so-and-so's file, read somebody's file, and transmit the information? I mean, so you can imagine a speedy response to an emergency saves lives. Go ahead, sorry. Just want to put a plug in.
It's okay, sir. And it's not just technology. There are lots of business practices and rules and ideas about how this data should be shared, and we don't want Washington to decide that. So we've been working with over 100 different regions, state projects, municipal projects, projects in Delaware, Rhode Island, and Florida with your brother, sir, who are come together.
Keep his job.
But they're coming together so that doctors and hospitals and pharmacies and consumer groups all decide how they're going to share that data in their region. And this is a major movement that's going all across the United States that we have the privilege of supporting and being part of. The third thing we want to do is make sure that consumers, that all of us can see our own health information, that it's just not the doctor that sees it, but we can see our lab results, and we can find out how our cholesterol is, and if we have diabetes, what our blood sugar is like, and that we can see who sees our data and what's being done with it. This personal component is a big piece. And then finally, we want to modernize and streamline the way we report public health information, the way we collect information for bioterrorism, for clinical research, and for monitoring the quality of care. We have to build a modern apparatus that collects this data so we can keep track of population health improvements and making sure that the overall health status of the American people is improving over time. We have a lot of work to do, but we've laid out a plan, and this plan puts the work in the private sector with the support of the federal government, and we're moving along, and I still stand behind my comment to you, sir, that I think we can do it in 7 years and not 10 years.
Well, thank you, sir. David, thanks. He's outlined kind of a national vision, a national strategy, which is being implemented from the ground up, by the way, not the top down. That's why we're here at the hospital, because they've implemented really interesting information technology here. Let me just say one thing before we get to some docs who are on the front line of change. One of the things we have to do in this society is to have a judicial system that's fair and balanced. And I can't help but think of these good folks who are practicing medicine and realizing that too many of their fellow citizens are leaving the practice of medicine because of junk lawsuits. This society needs to have balanced and fair law. And it is important for members of Congress, members of the United States Senate, to know that a unbalanced legal system, a system where the law is like a lottery when it comes to suing people in medicine, is driving good people out of practice. We need medical liability reform now. Anyway, Martin Harris. Martin, what do you do? Dr. Martin Harris, excuse me.
Great. I am a general internist, but I'm also the Chief Information Officer for the Cleveland Clinic Foundation. And
That's pretty good. Yeah.
yeah, it's a good combination. Keeps me up.
That's strong.
Great.
So a man of many talents.
And I thought what I'd do today is talk a little bit about what the electronic medical record is, so everyone clearly understands it. Talk about what its value is to patients, and talk about how we are currently using it to improve patient care. So the electronic medical record is more than just converting paper into digital information. What it is a change in the culture of medical practice so that we begin to think about using information in real time and sharing that information for the benefit of our patients. Now, we do need computers to get the information in, but once it's in, the real value is in what we can do with it. Let me give you a couple examples. When an electronic medical record system is in place, a patient will never have to worry about receiving the wrong dose or an inappropriate medication simply because someone couldn't read the handwriting on a piece of paper. The same thing will be true in terms of how often patients have to repeat their medical histories when they have complex diseases and they're seeing multiple physicians. If an electronic medical record system is in place, those physicians will know immediately what the patient's medical history is, and they'll be able to use that for the patient's benefit. And then finally, the example that used earlier is a patient, if we ever have to accompany a patient into an emergency room when that patient cannot speak for themselves, an electronic medical record will be able to speak for that patient because their history will be there, their medication history will be there, and they will not have to recall information on their own. Now, let me talk to you a little bit today about what the Cleveland Clinic has been doing to make this a reality. We have an electronic medical record system in place. It is the glue that ties together our large physician practice. We have over 1,200 physicians here in the Cleveland area who practice across northeastern Ohio. We also have thousands of nurses and other allied health professionals who use this same tool when caring for patients. What we have been able to do is to use this information technology to address three key areas. The first one is patient safety. Let me give you an example. Last year, our physicians wrote 2 million electronic prescriptions. Now, what's really important is not the volume, but the fact that each prescription was checked by the computer to ensure that our patients were not negatively impacted by an adverse drug event or bad drug interaction. So that's an example of improved patient safety. On the quality side, we use that same computer to identify when patients need health screening tests so that we can do preventive activities more consistently and identify abnormalities early when they are in fact treatable, so that in fact we are improving the quality of the care that we're providing to patients. And then finally, there is the efficiency issue. We have physicians who practice as far away as Lorain, Ohio, or as far east as Chagrin Falls. When those physicians' patients come to this main campus in order to receive their care, their electronic medical record is already here. It doesn't have to be repeated. We don't have to mail it here. We don't have to fax it here. That's an example of real efficiency in the healthcare system. Now, let me just give you two other examples that I think are very important about how this technology can expand our relationship with patients. We have deployed a system for our patients. We call it eCleveland Clinic MyChart, the patient's chart. So patients can be at home and connect to us over the internet and see their electronic medical record. I'd be willing to bet that the vast majority of Americans have never seen the information that's been written in their chart. This gives the patient access to their lab test, They can schedule appointments, they can renew their prescriptions, and they can see those same health maintenance alerts that I talked about so that they can initiate care on their own when they need it because they're informed. This information empowers patients to be informed partners in the healthcare decision-making process. Stay out at the patient's home. The other initiative that we're working on under the rubric eCleveland Clinic My Monitoring is the ability to be ready for the next 20 years when medical devices, which are very sophisticated, will be implanted in patients. 8% of Americans have those devices today, but they're relatively simple. They're artificial hips, they're artificial knees. But over the next 20 years, those will become sophisticated devices, and they will be able to communicate information about the device and about the health status of the patient. We have a program in place today associated with pacemakers of various kinds so that patients can be at home, connect to us via the internet or over a telephone, and then be reassured that their provider has all the information they need to support their care, even when they're not in our office or in a hospital.
Yeah, you're doing good.
Okay. All right. I do have one more. And I will point out to you that everything I'm talking about will be in place in Florida by July this year.
Let me ask you something. I know you got one more. I don't want to... I'm just sitting here thinking about, I'm sure there are people out there saying, I don't want my medical records floating around, ether so somebody can pick them up. I mean, I presume I'm like most Americans. I think my medical records should be private. I don't want people prying into them. I don't want people looking at them. I don't want people, opening them up unless I say it's fine for you to do so. Explain how you...
Absolutely. So that is true, and it's true whether it's in electronic form or whether it's a piece of paper. We want to know that the record is secure and that it remains confidential. But information technology actually works perfectly to document that. If you left the medical record on paper in a room, how will you know who saw it? You can't know. When it's in electronic form, when anyone logs onto the system, we know. We know who they are, we know where they are, we know what they were looking at, and we can keep logs of all that information so that we can confirm for our patients that their information is secure.
Okay. One more?
Yeah, I do have one more. So we've talked about how we can use this technology for individual patients, but what I will tell you is it's equally important when we think about large populations of patients. And we at the Cleveland Clinic have a mission of clinical research. And the electronic medical record now is a fundamental tool in generating new knowledge that will allow us to translate that information into new services that will help improve our patients' care. Let me just end by saying David did mention one other point that I think is a remaining challenge for us, but I do appreciate his effort in being able to frame out those challenges and to present some solutions to this issue of interoperability. Our electronic medical record system has 3 million patients in it, 100 million data elements about those patients, but that's not enough. If we're going to meet the goal of improving the quality of care for all Americans, we have to be able to get to all the information about a patient, whether it's in a retail pharmacy, whether it's in another provider organization, whether it's in a payer organization, so that we can bring all the information related to a patient together at the right place in front of the right person so physicians and patients can make the best possible medical decisions.
Yeah. See, what he's saying there is that these networks are beginning to grow from the Cleveland Center out, and the fundamental question is, can the Cleveland Center's network talk to somebody else's network so that you can exchange information? It's one thing to have information on a regional basis. We need to have it on a national basis so that information flows, across our country, and that's what the interoperability means. Listen, you did a fabulous job.
Thank you.
Really good job. Dr. Bob Uhas.
Yes, sir.
Dr. Uhas, thank you for being here. What kind of doctor are you, besides a good one?
I am a primary care internal medicine physician, and I practice at the Cleveland Clinic Foundation Willoughby Hills Family Health Center. and our health center is located about 15 miles east of here. I had come to the clinic about 6 years ago, and when I first came, we did not have the electronic medical record, and so I had the experience of continuing in the paper world. And in the paper world, what would happen is we would have to have a staff person actually pull charts on the evening prior to a patient coming in to the office, and so they would have to compile those, make sure they got to the right place. And then when I went into the room, I'd have to look through that paper record and hope that all of the information was there for that visit. Some of that time would be spent actually writing into that chart. Some of that time would be asking questions of the patient. But then again, if I went to look for something, it would be flipping through a paper record, and that could be hard for somebody because I'm basically flipping through the chart. From the standpoint of making sure the information was there, if it wasn't there, then we'd have to get on. I'd have to say, excuse me, and open the door and ask the patient or ask the staff to go ahead and fax something, have something faxed from somebody, or ask for a request to allow that information to be coming over from another facility. So it would take time, and we might or might not get that information while a patient was there. So it was fairly inefficient that way. And then usually after seeing the patient and they check out, I would actually then spend some time in doing some dictation. That dictation would have to be transcribed, and then that would take several days to get back to the record. So it was sort of a long process. It might take several days for that to turn around. About 3 years ago, our family health center became one of the first centers to implement the electronic medical record. And how that was helpful was, first of all, it changed the way that we see patients. We weren't dependent on waiting for a record to come over. So when the patient came to the office, they were checked in electronically, their information was verified and updated, and when they came back to our office, the medical assistant would be able to see them, enter their vital signs, and then also when I came into the room, I was able then to see that information right there was legible, it was readable, and clear. And then I was able to, and I am able to, go ahead and enter the patient's history and their records using charting tools that are very clear to be able to be read, and certainly while I'm doing that, the patient is there and they can participate in giving history, and certainly if there's something that I'm putting in there that they disagree with, they can update that right there. I think the other things that had changed, though, were the ability to be able to look at any testing that they've had done because it came back to me electronically, or any consultations. Certainly if I'm seeing a patient in the office and I send them here to the main campus to see one of the specialists here at the main campus, and they're coming back to me, in the old situation would take several days. I might have to wait for inter-office mail for paper to come back. But even if they saw that specialist yesterday, if I go to the office today, it's the consultation would be there today. So if they were coming to the office, I'm not saying, well, what did Dr. So-and-so say? I can say, well, let's pull up that consultation and let's look at that together. So it's an opportunity for patients to feel like there's communication between their healthcare providers. The other thing that has been very helpful is anytime I'm pulling up any kind of tests in the office, I'm able to compare those to any previous testing that they've had, and I'm able to pull those up in a flow sheet format so they can see how does that compare to their previous laboratory work, where have I been, where am I going. I'm also able to put that into a graphic format. Some of us learn better visually rather than through words, and so certainly that's a way that I can help patients actually be able to see where their laboratory results are going or where they've been, and help them to make lifestyle changes. So it's actually a tool for me to help them as far as teaching. Dr. Harris mentioned the health maintenance tools, and that is, again, doctors want to do the right thing for the person when they're there. And so the opportunity to have reminders or prompts to note that a person is due for a preventative health maintenance test is helpful for us, again, to make sure that we're getting things done at the appropriate time. So all those things have been helpful. And lastly, Dr. Harris mentioned the eCleveland Clinic MyChart. This has been a tremendous tool for me to be able to communicate with my patients after they've left my office. So often after we leave a physician's office, we're wondering, what did he say? And so this has been an opportunity. Anytime patients are having testing done, again, prior to having MyChart, I would have to look at that test, generate a letter, have that letter printed, have that letter sent by mail to that patient. It would take quite a while for that process to occur. And with the MyChart, it allows me to look at that laboratory information, be able to put a secure message to that patient about their laboratory data, and it sends them a secure message to say that you have something to look at in your MyChart site. They log on in a secure way to that site, and they're able to actually review their laboratory work, anything that they've had done previously, as well as my notes. They're also able, if they need to ask for a prescription refill, or if they need to get a future appointment, they can do that. And for patients like Patty, that is...
Patty, your patient?
Yes, she is.
I'm the patient.
Good. Sometimes we leave the doctor's office or wonder when you get new magazine subscriptions. Anyway.
Try to make sure those are updated.
Patty?
Yes, sir.
Bob's your doctor?
Yes, he is. He has been for
Looks like
6
a fine
years.
man.
He's a wonderful physician.
By the way, before we get to Patty, just think about how many Bobs there are in the world who will go from writing and wondering and picking up files and to an efficient system. And when that's what he just described, the efficiency he just described, it means he's saving time and therefore money for the patients. And when you multiply the efficiencies to be gained all across the spectrum, whether it be individual docs or hospitals or networks, that's why some predict that you can save 20% off the cost of health care as a result of the advent of information technology. Patty.
And 2 years ago, when I saw him for my regular physical, that was about the time that the MyChart system was coming into play at the Willoughby Hills facility, and he mentioned it to me and said, maybe you might want to think about registering for this. Well, I'm not a real techie person, and so, but just to appease him, I said, I'll think about it. So I took it home and I looked at it, and it actually looked pretty simple. So I did register, but in the back of my mind I thought, I'm still not going to use this, but it'll make him happy that I at least registered. During that appointment, when I saw him 2 years ago as a part of my regular physical exam, he had ordered some blood work to be done. About 2 or so weeks after the blood work came back, one of his nurses called and said, Dr. Uhas would like to see you again. He's concerned about some results that he found. I was expecting to hear that my blood glucose levels were high because I have a real strong history of diabetes in my family. What they told me instead, though, was something that I was totally not expecting, and that was that my cholesterol was high and my triglycerides were high. So I got off the phone with this nurse, and I thought, wow, I am just totally shocked by this. I felt pretty helpless and confused and very concerned. And even though we had made an appointment, it wasn't for another 2 weeks. And I'm a worrier, so I knew that for the next 2 weeks I was going to spend a lot of time worrying. In the meantime, I happened to get an email from the Cleveland Clinic saying that you have some information to review in your MyChart. Click here, and it'll be available for you. And I went, oh, that's that thing that I registered for that I said I would never use. Well, I clicked on it. It was very simple. I put in my password and my logon ID, and lo and behold, there were all of my test results. And it was wonderful. I went from feeling helpless to feeling in complete control of the situation. It not only told me what my cholesterol values were, it told me what normal was. So I knew how far away from normal my situation was. How bad was I? Was I just, a little bit unhealthy, or was I a lot unhealthy? What did I need to do? The other wonderful thing about this system is that there are links embedded into it, so that if you don't understand something, you click on the link and there's this wonderful information that pops up on your screen, and you've got all the time in the world to sit there and read all about it. It really empowered me. It allowed me to really think about what was going on and to put together in my mind some what I thought were intelligent questions to ask him when we did get together. And it really did make me feel like I was part of the decision-making process. When we did finally get together, I'm very grateful. He's a wonderful physician. He doesn't jump the gun on things like prescribing medications right away without trying other things first. Together, we decided that I needed to make some lifestyle changes, and I was very much a part of that process and really bought into it because I felt like I understood, and I was just totally educated by this my chart that I had never thought I would use. So it was a great experience.
You did a great job. I think one of the things that's interesting.
Thank you.
What struck me about Patty's conversation is that how liberated she feels through information, and that I'm sure a lot of patients, and you probably can testify to this, are pretty nervous about dealing with doctors and kind of the words and the diseases and all this stuff. And all of a sudden, the more educated you become, the more comfortable you become, not only about figuring out what's wrong, but more importantly, figuring out how to cure the problem. And information is a liberating tool, and it's liberating for a lot of parts of life, including healthcare. So thank you for sharing that.
You're welcome.
Jorge del Castillo.
Sir.
See, I'm Jorge too.
It's a good name.
That means George. He's Jorge D. I'm Jorge W. Anyway, so where do you work?
I'm at Evanston Northwestern Healthcare in Evanston, Illinois. Our hospitals are 3. We have 65 outpatient facilities. All of them are integrated vertically in an electronic medical record that is totally paperless. We use very little paper at the hospital, basically paper that comes from the outside. But for me personally, as an emergency physician in the emergency department, what's greatest and so exciting is the fact that when you see a patient come in the past, I would get a pile of papers if I was lucky. And I would have to pore over them to look for an EKG, look for lab results, look for any number of other things. Now I stand by the patient with the computer. I can actually show the patient their record. I can actually see the results from 2-3 years before, which we have archived. When the patient leaves, I can actually give them a CD with their radiology results, their lab results. The discharge instructions are legible. They have a diagnosis that they understand. So the best thing, though, is the fact that the patient can be taken care of in an expedient manner. I'll give you a very brief anecdote. I had a patient the other day who came in with some cardiac issues. I had seen his cardiologist about 3 days prior. Well, of course, it's a Saturday morning, cardiologist was not around.
Golf course.
Well, he had to play with orange balls in Illinois. but anyway, he may have been there, sir. In any event, I couldn't find him, and so I talked to his partner. Of course, his partner didn't know the patient, but I was able to find a record. I saw exactly what the cardiologist had written down. I saw exactly what his thought process was. I got a couple of tests on this patient. I talked to him, and we saved him an admission for probably 48 hours. That would have cost money, would have probably burdened the patient with unnecessary tests, because I knew exactly what his doctor was thinking. So that's been a great thing. The one thing that you did mention before and that Dr. Brailer mentioned, which will be a boon to medical care in IT, is to have the entire nation be able to log on to a main database where you have some basic information on the physicians and on the patients who have prior histories of whatever they might have, so we can actually be able to take care of the patient in a more expedient and reasonable manner.
How long have these medical records been available in your situation?
We deployed, we started in March of 2003. This March will be 2 years. Interestingly enough, most of our physicians went into the electronic medical record kicking and screaming, and now they can't live without it. The system went down the other day for about 2 hours, and there were just complaints and cries of help and so on, because you just cannot live without it. It is just one of the best things that can happen to the medical field.
Yeah, you see, it's interesting, isn't it? I mean, they've only had this technology for 2 years. I mean, we're talking the beginning of a development in healthcare that is going to be life-saving and cost-saving and changing for the better, and that's what's so exciting about it, and I appreciate you sharing that with us.
My pleasure, sir.
We got one other doc here to talk to, Barth Doroshuck. Barth, where do you live?
I'm from Bethesda, Maryland, Mr. President.
Right, yeah.
Yep. Right next door.
Within spitting distance of the Capitol.
Exactly.
Give us a sense about you. Actually, I'll introduce Barth. Barth is a kind of, I wouldn't call you sole practitioner, but close to it.
We have a small practice in Washington, D.C. and in Maryland. The Washington ENT group provides ear, nose, and throat medicine and head and neck surgery to the regional area of the metropolitan
And how many docs?
DC area. We have 6 doctors.
So it's a relatively small practice, yeah.
Small compared to the testimonies we've heard this morning already. 4 audiologists and a radiology technician, because we do some x-rays. And when we went into electronic medical records back in 2000, we were looking at starting the practice up, and we had a choice. Do we do it the way we've always done it, or do we move ahead? Is there technology that's there? Is it reliable enough? And is the investment safe? And lo and behold, we decided to go ahead and implement a fully digital medical office. And we haven't looked back.
Which, by the way, has got to be a pretty serious decision for a very small doctor's office. Now, there's a lot of doctors out there saying, I don't think I need this. And therefore, the cost-benefit ratio certainly doesn't justify me, the sole practitioner, or me, operating with 3 or 4 other docs.
We had a lot of people look at our business plan and our ideas, and just so I didn't have the feeling we were trying to convince ourselves. A lot of our contemporaries for the first year were holding their breath saying, oh, this is going to be an interesting year to see this practice if they survive. And we're going into our 4th year now. We've opened up a 2nd regional center, and all the testimony we've heard today, we've experienced. The digital doctor's office really eliminates all of the wasted time that you spend looking for things, or trying to return a phone call, or waiting for a phone call, or waiting for the patient to go get an appointment for the test next week, to get the test results the following week. We see patients, and they go into our testing center, and they come back the same appointment, and the doctors are able to sit with them, transmit the x-rays to the radiologists in what we call our medical information highway in the metropolitan D.C. area, and get the very timely feedback, the same appointment. And by the time the patients leave our office, we really have accelerated the diagnosis phase of medicine and can get into the treatment phase. And for some patients, that's very, very important, depending upon their situation. But many of our patients, in fact, most of our patients leave the office, their referring physician who sent them to us already has the consultation report coming across the wire in the form of a fax, or in some cases, some doctors still prefer a letter. So we'll send them a letter with a stamp on it. But it's really quite an amazing leap that we can go from days and weeks to very timely diagnosis and treatment.
Is the cost benefit, I mean, is it clear to you now that?
It's very clear to us.
Yeah.
Very clear to us. When we opened up our second office, it was not even a factor.
So it kind of defies the notion that there has to be economies of scale in order to benefit from IT. In other words, big hospitals with a lot of docs will benefit, but little docs won't be able to afford the cost. And it's very important for docs who are listening to this to understand that the cost benefit is noticeable and real. And not only that, you're expanding as opposed to going out of business.
That's exactly right.
Yeah.
That's exactly right. We're very excited about this. We just had a regional meeting in Maryland of other doctors' offices, private practitioners, not the large Cleveland clinics, who are also getting into electronic records. And we're forming a little users group to talk about how we can, again, gain economies of scale and continue to save money at our level when we don't have the $100 million budgets. So we're really reaching out and trying to work together at the private practice level.
The role of the thank you, good job. The role of the federal government is not only set the strategy, but to spend grant money to encourage the development of regional hubs and to really get the process started. There will be a certain momentum that will be achieved once the cost benefit becomes aware to everybody that's a practitioner. But the government's role is to help best practices get started. We've sent out 2 federal grants from HHS totaling $3 million to Cleveland Clinic to help spur and spawn this fantastic technological development. One of the things that I'm excited about is that we're just beginning to learn about the great potential of information technology. And I think what you're witnessing is a dialogue about a subject that is going to change our lives for the better. And that's why I'm excited about it. I can thank our panelists for being here, for sharing your knowledge, your firsthand knowledge about what is possible, what's taking place. Imagine what the world is going to be like 10 years from now. I mean, what we're hearing today is it's just the beginning of substantial change, all aimed at improving people's lives and making sure that health care is as affordable as it can possibly be for every citizen. I hope you've enjoyed this as much as I have. I have found it to be incredibly informative, and I want to thank our panelists once again for sharing their wisdom and knowledge.